Good morning. You can tell we're back in the dining room. I'm back in this beautiful pink shirt, and but I have a little bit of good news for y'all. I'm getting a haircut today. I'm actually going to get to go to the beauty shop, and Jessica is going to do something with this mess. After I got in from the doctor yesterday, I laid down and took me a little bit of a nap, and then Becca saw me, and she's like, Mom, what are you doing with that hair? And I said, it's called whatever it wants to do. It's like just living life out there. So, but today I've been sporting the styles that Brian can do. And so we're going to get something done to this mess today. But I just wanted to give y'all an update on a few things and just kind of fill you in on how things are going. And one of those things is I've talked a lot about transformation. I've talked a lot about change, and I'm going to pick up back on how I got here in a few minutes. But I want to talk to you about being a patient for me. For me, that is a huge change. I am a nurse, and a little fact that a lot of people may not know about me is that I don't like the sight of my own blood. Now, I'll clean up your blood all day long. I'll poke you with a needle to save your life or to get your blood. I don't mind at all. I'll give you a shot. I'll do anything for you. But you come at me with that needle, and I really kind of start to feel faint. And, you know, Brian giggles at me because when I was in my master's program, I had to get an immunization. And he's known this about me, but I really haven't had to have a lot of shots in my life or anything. But I had to go over to Corsicana to the health department, and I had to get an update on my MMR. And I went into the health department. I was a big girl. And I got my shot, and they gave me my superhero Band-Aid. And we got up. We walked out of there. And I got to the car, no problem. And we literally drove from one parking lot over to the other to the grocery store. We made it about halfway down the first aisle. And I said, honey, I don't feel so good. And in just another couple of seconds, I was almost fainting onto the floor from the shot I had gotten like 5 minutes earlier. So, that's truth. I have little tears that run out when they go to poke me with my needles. I'm a chicken. I just don't like it. I'm the lady who, if I cut myself with a knife, I have to drive down the road with my arm hung out the window for somebody else to look at it. So, this has been very different for me because now I'm sporting drains that have my own blood in them. I'm looking at them. I'm helping Brian measure them. We're draining them. So, you know, that has been a transformation for me. And, you know, that's growth. And that hasn't been an easy growth for me. And I know some people are like, that ain't nothing. Well, that may not be nothing for you, but maybe, you know, heights are nothing for me. Maybe that's what bothers you. Everybody's got something. So, I'm just wanting to put that out there. So, you know, that's a fear that I've overcome. And, you know, I was able to get my IV at the hospital. And I didn't shed a tear, and I didn't pass out. I was laying down, but, you know, I didn't pass out. And when they drew my blood, nobody had to go back and hold my hand. And I didn't pass out. So, you know, small baby steps. But there's a little bit of truth on that. So I just wanted to let you know that, you know, it's all growth. There's all growth in these things. I am sore today, very sore from my tubes coming out yesterday. I am a nurse, and I have seen them pull tubes and never thought anything about it. But wow, that was pretty impressive stuff. You know, she did hold my attention, and then she says, okay, she clipped that little stitch, and she said, okay, here we go. And she just goes, whoop. And I hold my breath because it took my breath away. And that tube just goes, whoop, right out the top of both sides. Whoop, right out the top of both sides. It wasn't as much that it was horribly painful, but it was just that you could feel this very firm tube come up and over and out. It was very uncomfortable. But today I feel sore from where that tube was. She says I have a lot of bruising, more than the average pup. but I always bruised easy. Brian's called me his little delicate peach. But, so I don't know. I could not sleep on my sides last night. I know that for sure. Back to the back sleeping, which I don't like. So, you know, there we go. That's a little bit about that. But, you know, I'm surviving and I'm grateful. But today's just a little bit sore than I was. So, you know, it's like 2 steps forward, 1 step back. But as long as we're moving forward, that's all that matters. So, kind of picking up where I left off yesterday, I think that I was at where I was going to get the biopsy for this time. And now we are in May of this year, and I went in to get my biopsy, and I had a lot of peace. I really hadn't told a lot of people about it. You know, I said they found a spot. You know, I'm going to be real honest here and say that people don't want to hear that you had a spot and that you were miraculously healed. If you don't have, basically, it's kind of like buying a car. If you don't have papers to prove it or prove the information on that, or buying an antique, if you don't have papers to prove that, then people really aren't interested. It's just truth. It is what it is. And my biopsy said negative, although there was all the controversy around that. And then the spot was gone. So it's really hard for us as humans to get our head around that, me included. Although I knew it happened. But this time, Louisiana was sitting there pretty as could be, right on the inside of my breast. And, but I felt different. This time I didn't have fear. This time I had a peace that I cannot explain. And I went in to get the biopsy. Brian was in the waiting room. They called my name. I go back, and if you've never been to the breast health center, they have 2 sides. I like to call it the good girl side and the naughty side. And if you've never had an issue, they send you to the good girl side. If you've had an issue or you have to have an ultrasound or a biopsy or something like that, you go to the naughty girl side. So, of course, now I live at the naughty girl side. Not anymore because I'm not going to have those. But anyway, I would be at the naughty girl side. So I would go in to change my clothes, and they give you this little key to your locker, which is important later. And I changed into the little robe and put my clothes up on the shelf. Why I did that, I have no idea, because that's not where they go. They go in the locker. And I remember sitting on the side of this big cushion that they have and just taking a breath and just talking to the Lord for a second and just saying, I don't know what's going on. I have this crazy peace. I can't even feel this lump. I couldn't feel the lump last time. Is this cancer? Because this is a yo-yo and I don't understand. But I told you last time to do whatever you needed to do. So I'm with you this time. I'm following this time. And that's a key for me. Last time I was running. I was running in fear. This time I was following. And I had peace. And he said to me very clearly, he said, and this has been very key for me throughout this whole thing. He said, be still and know that I am God. And as soon as I felt that verse come across me, I knew I had cancer. I just knew it. It's like it settled in my spirit, and I knew. It kind of shook me so much that I didn't put my clothes in the locker. I left them there for everybody to see my goods. I had my bracelet on. I went out, sat down. Now, girls, I left my phone, my clothes, everything laying in that dressing room. I went out. They called me back. They do the biopsy. Well, a lot of times, I mean, it's an old nursing wives' tale, I guess. But when they pulled the plugs from the first biopsy, my biopsies floated. And a lot of times, it's kind of said, like, you know, if they float, they're not cancerous. But if they sink, they're cancerous. Well, the radiologist pulled them, and they sank. I mean, like, heavy, like rocks, buddy. Every one she pulled. And this time, though, it wasn't painful. And I could actually see myself as she was pulling the plugs on the screen that she was dead on in the tumor. Because this time I was watching. And I saw her put the marker. They go back, they scan me. She shows me that the marker is dead center in the tumor. Once that is done, they say, okay, well, we're going to let you know in a week. It takes a week to get these results back. So I'm like, okay, a week it is. So I take my key out to my locker, and I'm looking for my clothes. And I'm embarrassed because there are no clothes in that locker. But I can't remember that I didn't put my clothes in the locker because, I know I got cancer. And I'm like confused, but I don't want to go back and tell anybody there's no clothes in that locker. So I remember waiting like I was stalking some old lady in the dressing room for her to come out. And as soon as she came out, I ducked into the same dressing room. And there they were. Phone, clothes, everything. Somebody had neatly folded them, taken all my stuff, and just set it inside of the shelf. I was like, oh, thank you, Lord. Everything. My debit card was in my phone. Everything was where it was. I just took it all, gave glory to God, put it on, threw my little robe away, and I went out to the waiting room. And I remember telling Brian when I went outside, he was there and he was eager, He's like, okay, are you ready? And I just looked at him and I told him, I said, I have breast cancer. And the look that fell across his face was like somebody punched him in the gut. And he said, how do you know already? They already told you? And I said, nope. I said, I just know. I said, the Lord told me when I was in the dressing room. And he said, the Lord said, Lynette, you have breast cancer. And I said, no. He said, be still and know that I am God. And I just know. And my husband is an optimist when he wants to be, with things pertaining to me. Otherwise, he can be quite the pessimist and I'm the optimist. So I resolved myself to that fact. And I accepted it pretty easily. This time not in fear and not hearing Satan whispering in my ear. I didn't get the depression that I'd had. I got kind of a resolution to myself that, okay, I'm okay with this. If this is what has to be in my life, this is just what has to be. Because you see, I've been asking for some pretty big things in my life. I don't know about you, and I'm not saying that God does things, but he allows things sometimes. I didn't want to have breast cancer. And I don't understand the ways of God, but it happened. And so Brian and I had decided we just primarily work weekends, he and I both. And we had decided we were going to try to get away to go to Groom, Texas. Because Diane Barnes has always talked about Groom, Texas. And the Stations of the Cross are at Groom, Texas. And I felt like I needed to go and see Groom, Texas. And, oh, goodness gracious. You just saw my ceiling. My husband just put a new ceiling. I felt like I needed to go to Groom, Texas and see the Stations of the Cross there and get to walk around and be in the Lord's presence. And this was on May 13th. So we are Jeepers. I got a new Jeep when I got my master's degree. It was a gift to myself. And so we've become Jeepers. We like to just put the top back and get on that road and head out. And so we had loaded up the Jeep and we were going to Groom. And we made it, I don't know if people understand when we live everywhere, but we had made it all the way from between Hillsboro and Itasca to Covington, Texas. For some reason, we decided to do a little something different with the top on the Jeep. And we were fiddling with that. And my phone rang. And I looked at Brian and I said, this is the nurse navigator. So I picked up the phone and the nurse navigator says, "Hey, Lynette, this is Tony." And I said, "Hello, Tony." And she says, "You're Bob, Caesar, and Hun." And I said, "Yes, ma'am." She says, "And you have breast cancer." And I said, "And I knew it." And she said, "You'll be surprised at how many women say that when I call to give them the news." And so she starts telling me all of the details about the types of cancer I have. And I said, "Could I get a pen? Because I need to write this down." And so I get a pen and I get a piece of paper and I just start writing down all the information that she's given me. And she's telling me, "Well, you have, invasive ductal breast cancer. It's the most common type of breast cancer. 85% of breast cancers are this type of breast cancer. That means that it's the most likely to be treated. We need to now send it off to find out if it's hormone related or if it's not." And I am asking her, what do I want it to be? I mean, if you're going to have cancer, what is the better types of cancer to have? Because, let's figure that out. And she said, "Well, you don't want it to be what's called triple negative. That is harder to treat." So I'm going, okay, no triple negative. So I'm writing all this down because this is not my area of nursing. I deal with hospice. I mean, we've already stopped treatment by the time I get my patients. So my specialty is in that area, not oncology. So I'm writing all these things down that she's saying to me. And then she's saying, "So what we need to do is we need to get you into an oncologist first, and we need to get you into a surgeon." And I'm like, okay. So she's like, "Do you know who you want to use?" I'm like, I do. I want to use Dr. Encarnacion as my oncologist. And I knew that because 10 years ago, some of you may remember that the Presbyterian Church had a benefit for me because I was undergoing, I had to go to Mayo Clinic for some treatment. Well, they were trying to decide what I had, and it was called myasthenia gravis. And you've heard me talk about that a little bit. And at that time, they weren't sure why I had it because I didn't respond to typical treatments, and it was this really crazy mess. And I had to go all the way to Mayo Clinic to figure all of these things out in Minnesota. And I had something called paraneoplastic syndrome. That is some crazy big old words, isn't it? But what they told me was, you have an underlying cancer in your body. We know that from this antibody. It's going to poke its head up at some point in your life. And if we cure that cancer, your myasthenia should go away. Now, that should happen within 5 years. They told me this over the phone because I'd already left Mayo Clinic. And so I saw Dr. Encarnacion, and that was 10 years ago, folks. And when I saw Dr. Encarnacion 10 years ago, he told me, "We'll find it." He said, "But with numbers like yours, I would expect you to be very ill, and I would expect to be seeing you in the hospital." He said, "So it's very confusing to me that they think you have paraneoplastic syndrome with numbers like this. I think your myasthenia has to be related to something else, and that this can't be the reason of your illness." So he redid the labs, and sure enough, my numbers were even higher. He said, "So we're going to start scanning you every 6 months. We're going to follow you. We're going to do all these things." I did that for, right at 5 years. They never found the cancer. Praise the Lord then. But the mental toll of that was so great for 5 years. Every 6 months, I would wonder, is this the time? Am I a ticking time bomb? Because his words of when they found the cancer, it's going to be bad, it's going to be aggressive, leaned in my ear. I couldn't live life. So finally, I just decided I had to let that go. And that if they found cancer, they found cancer. I was just going to have to live life. And I was just going to have to embrace myasthenia. So that's what I did. So when I showed up in Dr. Encarnacion's office 10 years later with a diagnosis of invasive ductal breast cancer, I have to say, he was a little surprised. He says, "Breast cancer, that's one of the top 5 cancers that they thought that you would have from Mayo Clinic." And I said, "Yes, sir." He said, "Well, maybe this is it." And I said, "Maybe it is." They also sent me to see a surgeon. I did get to pick him. And I picked the surgeon. He came highly recommended. I still recommend him. He is very well thought of. He's a very good surgeon. No complaints about him. He was very good. I went over. Brian, I saw him twice, actually. He gave me my options, which are my options. They're my choices. I was very comfortable with him. I'm going to just say at this point that the choices that you make about your healthcare are your choices. My choice may not be your choice. It's your choice. So just because I chose one thing doesn't mean that it was the right choice for you. So I saw the surgeon. First, the oncologist is pulling all kinds of tests. We have to find out if it is all kinds of things. Like, is it genetic? Is it, was it that triple negative? Was it hormonal? There's just so many tests that they pull. Like 15 tubes of blood, and I did not pass out. Woo, 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 and Brian didn't hold my hand. And so then when I go to the surgeon, he says, okay, so you're going to have to make a choice. You can either have the lump out and have 30 doses of radiation. That's 6 weeks, 5 days a week of radiation. And just have a lumpectomy. And he gave me the statistics of the cancer coming back at that point. They weren't bad. They weren't bad statistics. I'm just going to be real. He said, or you can have a mastectomy just on the left side. Or you could have a double mastectomy. He gave me all the statistics for everything. Now, at that point, we weren't sure if I was going to have to have additional chemotherapy. We weren't sure if I was going to have additional radiation outside of what he's telling me. But for sure, if I only had the lumpectomy, for sure, if I just went with the lumpectomy, I would have to have 30 rounds of radiation, no doubt. So I knew right then, sitting in his office, what I wanted to do. I had already decided within myself that I wanted to go ahead and do the mastectomy. And I wanted to do a double. And so I kind of talked to him about that. And I could tell that he was not leaning towards that. He didn't feel that I could accept that. That I would be able to live with myself if I did that. That I was young. He told me, he said, you're one of my younger patients. This is a very drastic body change. This is not something that you should take lightly, that you should just make your decision on emotion. All good advice. All good advice. I really think you should think about this. I want you to take some time, wait for your test results to come in, and then decide what you want to do. All very good advice. I could tell that he was leaning towards lumpectomy, radiation. So Brian and I left there that day, and we got in the car, and we always make Dr. Day date day. That's one of the things that we do. We've done this for years. If we go to the doctor, it's date day, because we need to decompress after the doctor, and we need to discuss what's happening. We need to discuss how it affects him, how it affects me, and how it's going to affect our life. Now, that's not meaning if we have a cold or something like that. But if we're seeing the doctor for something really that's going to affect us, it's date day. We need to have he and I one-on-one together to discuss this, because if it affects him, it affects me. If it affects me, it affects him, and that affects our family and our life. So it's date day. So we went to eat, and I can remember sitting and talking to Brian, and at the moment, I could feel that he was leaning towards also the lumpectomy. I think he was leaning towards that out of fear. People with myasthenia do not manage anesthesia well. The last time I'd had surgery, when I came out from under anesthesia, I had difficulty breathing. He was afraid of that. He, I think, was also concerned that I would struggle with body image. It's real. All valid concerns. He didn't understand how radiation affects the body. He was not educated. he didn't know all of these things. So I really felt like unintentionally he was pushing me towards what I felt like was a man's point of view. I don't mean that tacky, but that's how I felt. It's real. That's just how I felt. So I said, fine. Let's wait for the test to come back. Let's see what the doctor says, and then we'll go from there. So we were in holding pattern, waiting on everything to come back from the oncologist and waiting for the oncology appointment to find out where we stood before any more decisions were made, before any more surgery appointments were made, before anything else would happen. So that's where we were at that point. And that's where I'm going to leave you in my story of how I got to where I am today. So the next time I log on, which will hopefully be tomorrow, hopefully this mess of a head I have will look better, because I will have seen Jessica, and hopefully she'll do something to this stuff that my husband can better manage, because I can't hold the blow dryer quite yet. And when you have stringy straight hair, that's your best friend. I appreciate everybody looking on. Remember to love your family, put God first in all that you do, and may all glory, honor, and praise go to Him. Thank y'all so much for your prayers and support. Please keep them coming. I am sore, but I am doing amazing in the doctor's eyes. All right, y'all have a great day. Bye.